I am Peter DiMartino, Executive Director of the AIDS HIV Services Group, ASG, in Charlottesville, Virginia. Charlottesville, located in central Virginia, is the home of Thomas Jefferson, and Monticello continues to watch over us and his University of Virginia, UVA. Our town of 40,000 is also the center of much of the commerce, culture, and services for the 5 rural counties that make up the district that bears Mr. Jefferson's name. We are one of the rare rural organizations that developed as a local response to the HIV and AIDS crisis. ASG has evolved with the epidemic, and we continue to remain relevant to our community despite the challenges of stigma, distance, and limited resources. 25 years ago, when the first cases of AIDS began to present at the UVA Medical Center, the fear and stigma of the unknown nature of the disease impacted our community's ability to respond appropriately. It was the family and friends of those early patients who walked through the doors of the quarantined ward to feed and bathe people who were dying of AIDS. Soon our founders realized that not everyone on the ward was lucky enough to have family and friends to help them die in dignity. And so ASG was born. My staff and I are the heirs of the compassion of our founders, and we now are an organization of trained professionals offering hope and meaning for living with HIV or AIDS rather than caring for those dying from the disease. 30 years into the epidemic, and 25 since our founding, I can assure you that none of us expected to still be here. We had hoped that the enlightenment that pervades Mr. Jefferson's Virginia would have impacted our local infrastructure's capacity for education, prevention, and care in the age of AIDS. What we have learned is that there will always be discrimination and prejudice, not only for people living with HIV or AIDS, but also for individuals and families dealing with their risk for HIV. At heart, we are a social justice organization, and our caring for the abandoned dying now informs our approach to living with the disease. We acknowledge and work every day to combat what drives this epidemic: poverty, sexism, homophobia, and racism. That may take the form of mental health counseling, patient-centered medical care, stable housing, employment readiness, substance abuse counseling, or simply a safe place to recognize who you are, but perhaps more importantly, who you want to be. At our core, we are an organization that meets individuals and families where they are and guides them to their next level of potential. We envision developing a healthcare access point that serves as an HIV-informed medical home, incorporating behavioral health and wellness, providing a patient-centered holistic care experience, one that allows people living with, affected by, or at risk for developing HIV or AIDS themselves to be part of a community that encourages them to live fully despite HIV or AIDS. And ASG will be there every step of the way to achieving that goal. As Mr. Jefferson said, I like the dreams of the future better than the history of the past.